Over the past 6 months, I had more than 7 medical appointments here in France. A mammogram, a visit to the dermatologist, a visit to the eye doctor, which led to a new prescription for glasses, several dental appointments, including dental work and routine cleanings, a complete government health screening, a visit to the podiatrist, and a trip to the GP for blood work and a prescription. And my total out-of-pocket cost for all of that? 138 euros, 90 of which was because I chose fancy glasses frames that weren't fully covered. So my out-of-pocket cost for all of that medical care was actually 48 euros. I'm Suzi, I'm American, I'm in my mid-40s, and I've been living here in Dijon, France since 2008. One of the most common questions that I get from viewers is about healthcare costs here in France. And I totally get why. As many of you are thinking of moving here, healthcare access and costs are huge concerns. Plus, the range of things that we hear about healthcare in France runs the gamut from it's the best in the world to it's totally dysfunctional and on the verge of complete collapse. I always tell people that in my experience, French healthcare has been easy to access, affordable, and of good quality. But I realized as a generally healthy person with generally healthy kids, I don't really have a lot of examples to back up my claims. And we have been incredibly lucky in that we haven't had to access healthcare for any catastrophic or chronic issues, really. Nonetheless, I decided that I would schedule all of my sort of routine healthcare appointments, some of which I had been kind of putting off, so that I would have some real concrete data that I could report back to you about. This is not meant to be an overall evaluation of the entire French healthcare system. I just wanted to report back with some individual stories about how the system has been working for me recently. So today I'm going to walk you through all of these appointments with complete transparency about costs, wait times, and how the system actually really works, at least here in Dijon in 2025. I'm also going to tell you what happens in emergencies, what pregnancy and childbirth are like here, give you a few tips for navigating the healthcare system here in France if you do wind up moving here, and briefly mention how the healthcare system here in France compares to other countries. By the end, you'll have a realistic idea of what healthcare looks like from my perspective of living here. And I think this information is really important. But before we get started, I just wanted to mention that if you wanted to sign up for my email newsletter, you can scan the QR code here or click on the link in the video description below. Okay, let's get started. First, the basics of how the French healthcare system works. It's a 2-tier system. Everyone in France is covered by the national healthcare system. It's called the CPAM, Caisse Primaire d'Assurance Maladie, or the Sécurité Sociale, colloquially known as the Sécu. I'm going to call it the CPAM during this video. If you're living and working in France legally, you're eligible for coverage. And everyone gets the same baseline coverage, which is more or less 70% of your doctor's visits and 80% of hospitalizations. There are some nuances, but that's more or less the basic coverage from the government. Now, if you're planning on retiring early in France before you're actually eligible for retirement pension, there is one thing you need to be aware of, which is the cotisation subsidiaire maladie, which is informally known as the PUMA tax. If you're living off investment or rental income above about 23,550 euros per year without any pension income, you'll pay a 6.5% charge on that capital income to cover your healthcare costs. I'll link to this article in the video description below because I imagine some of you might want to read this whole article. Then, in addition to the CPAM, most people have what's called a mutuelle, which is supplementary insurance, which is meant to cover most of what the CPAM doesn't cover for you. If you're employed, your employer typically pays 50% of your mutuelle premium. So we have access to our mutuelle through my husband's employer, and for our family of 4, we pay 47 euros per month, which is deducted directly from my husband's paycheck to cover our portion of the mutuelle premium. French mutuelles, with an S, are nonprofit organizations, which means that the focus is on member welfare and not shareholder profits. So the way it usually works is that you go to your doctor's appointment and you pay out of pocket for however much the doctor's appointment cost. But the healthcare provider will take your carte vitale and they'll run it through their system so that usually about 10 days later, the CPAM reimburses you for the part that they cover. And then shortly thereafter, the mutuelle will kick in with the reimbursement of whatever is remaining or whatever they cover. For prescriptions, the system is a bit different. Most pharmacies use a tiers payant system. So that means that you go to the pharmacy with your prescription from your doctor, which you give to the pharmacist, and they run your carte vitale and they scan your mutuelle card. And most of the time, if the drug is covered, you have nothing to pay for out of pocket. So the reimbursement happens behind the scenes without you having to do anything. This is something I still find really delightful, even after having lived in France for 17 years, when I go to the pharmacy and have prescriptions filled, and the pharmacist then tells me, "You're all set. Nothing to pay for." I still can't believe it sometimes. Of course, it's different if it's over-the-counter drugs. So if you don't have a prescription, then yes, you will pay for it out of pocket. And in France, chronic conditions like diabetes, heart disease, and cancer are 100% covered. You cannot be dropped from coverage, and there are no lifetime limits in terms of, I don't know, how much you cost to the system. They can't decide. They're not going to decide at some point that they're just going to stop covering you because you've cost the system too much money. Okay, so now you have a general idea of how the system works. Now I'm going to get into the nitty-gritty details of all of my appointments that I've had for the past 6 months. So for my dental appointments, I called the dental office on March 11th to make an appointment for routine cleaning, and I got an appointment for April 7th, so it took about 4 weeks for me to get an appointment. And I hadn't been to the dentist for so long that when I went to the dentist, she realized that I needed some work. I needed to have some cavities filled, and I even needed to have a wisdom tooth extracted. So over the course of the next few months, I had all of that taken care of in a series of, I think, 5 appointments. And it's been so long at this point that 6 months has gone by since my first cleaning. And so I was eligible for another cleaning. You can get 2 cleanings per year. Well, they have to be 6 months and one day apart. And the system will cover two cleanings, cleaning every 6 months and one day. So I've actually been back for my cleaning, my second cleaning this year, because I have resolved to try to take better care of my dental hygiene, because I've realized just how easy it is. And I haven't had to pay anything out of pocket whatsoever for any of the dental care that I have gotten over the past 6 months. Everything was covered. Sometimes dental care can be quite expensive if you have certain treatments, and I don't know the specific details, but I know, and I've heard people say that some dental care can be quite expensive and isn't necessarily well reimbursed or well covered by the mutuelle. So that is something to take into consideration. But for me, all of the dental care that I've had for the past 6 months hasn't cost me anything out of pocket. So another thing I decided to do was to go to the CPAM office and get a sort of government health checkup. This is something I feel like I never hear anyone else talking about, but you are eligible, I think every year or every 2 years, I'm not sure, to make an appointment and to go and have basically like a full checkup done. So my husband and I did this for the first time maybe like 15 years ago, and then we did it around our 40th birthdays as well. And I just decided to go ahead and do it again this year. So I booked my appointment for this on May 5th, and I used Doctolib, which is an online platform that some, but not all healthcare providers in France use for making appointments. And I was able to get an appointment for May 26th, which was 3 weeks later. So the appointment itself was free and very thorough. They asked me if I wanted to see a dentist, but I had just seen a dentist, so I didn't need to. And they asked me if I wanted to see an eye doctor, but I also had already made an eye doctor's appointment, so I didn't need to do that as well. They also asked me if I wanted to see a psychologist. They weighed me, they took all of my vital signs, and they did blood work. And the day that they took all of my vitals and everything like that, they made an appointment for me for June 17th to meet with a doctor one-on-one to go over all of the results once they had come back. So I had a meeting or an appointment with a doctor on June 17th, which was also completely free. So this is just preventative healthcare, meant to keep people healthy and screen, I think, for any sort of potential chronic issues that could come up and try to, take control of them before they become really serious problems. And I was on Doctolib again on May 5th, making an appointment to see my eye doctor. And I managed to get an appointment for June 16th. So a month and 10 days later, but I actually had to reschedule. So I wound up actually going to see the eye doctor on July 17th. So it was an eye exam, and I hadn't been to the eye doctor in over 3 years. So when I paid out of pocket 60 euros, and I, of course, gave them my carte vitale and I think my mutuelle as well. And the secretary at the medical office told me that I would be reimbursed at least 40 euros and that the rest would depend on my mutuelle. So that appointment was on July 17th, and I was reimbursed 23 euros and 63 cents by the CPAM on the 22nd of July, and 32 euros and 37 cents from my mutuelle the next day, the 23rd of July. So I wound up paying out of pocket for 4 euros for my complete eye exam and appointment with the eye doctor. And I walked out of there with a new prescription for glasses. This was the first time that I was going to be needing progressives and a little correction for reading close up. So then I resolved to head to the optician to see about getting some new glasses. And so for my new glasses, as I mentioned earlier, I did have to pay 90 euros out of pocket. That was just because I chose some fancy designer frames. If I had been more reasonable and if I had chosen some frames that were a little more affordable, then I probably wouldn't have had to pay anything. In fact, my husband just got new glasses this year and he didn't have to pay at all, nothing out of pocket for his glasses. And in fact, for me, the last time I got new glasses, I also didn't have to pay anything out of pocket. So I could have gotten away with paying nothing for my new glasses, but I did opt to get the fancy frames that I had to pay 90 euros for. And for my dermatologist, I called on April 11th, and I was able to get an appointment on September 15th, which was a 4-month wait for the dermatologist appointment. Granted, it was nothing urgent, but I have had some skin issues in the past, and so I thought that I was supposed to be making regular checkups. Granted, the last time I had been was 4 years ago, which I did not realize. The secretary told me on the phone when I made the appointment. The last time I had been was in 2021, which shocked me. Time goes by so fast, it's crazy. But I was also under the assumption that I needed to go somewhat regularly to get checked up by the dermatologist. And in fact, when I was there, he told me that no, in fact, I should be going to my GP for regular skin checks. And if my GP sees anything suspicious, then my GP will refer me to the dermatologist. So the appointment at the dermatologist cost 55 euros, and the secretary asked me to pay by check. The CPAM reimbursed me 20 euros and 16 cents, and my mutuelle reimbursed me 34 euros and 84 cents on September 25th. So I paid 0 out of pocket in the end for the dermatologist appointment. Next, I made an appointment for a mammogram and an ultrasound using Doctolib on May 19th, and I was able to get an appointment for July 31st, which was about 2.5 months out. The total cost, I saw the cost at one point on a document somewhere, and I wrote it down. The total cost was 104 euros and 65 cents. I paid 45 euros and 61 cents out of pocket by debit card, and my mutuelle reimbursed me 43 euros and 61 cents on August 11th. I guess the rest was paid for by the CPAM. So the cost for me out of pocket in the end, the difference was 2 euros. And I did need to go see my GP at one point, and I called, and it was Friday, August 1st. And I got an appointment for the following Monday, which was August 4th. So for the visit to the GP, I paid 30 euros out of pocket with my debit card. The doctor gave me a prescription for some allergy meds and a prescription to get some blood work done. So immediately right thereafter, I went to the pharmacy. I got my prescription filled, and I paid nothing for it out of pocket. And I think I went the next morning to get the blood work done at the lab nearby, and I paid nothing for that either. And the CPIM reimbursed me 19 euros for that, and my mutuelle covered 9 euros over the office visit. So my total out-of-pocket cost to see my GP in August was 2 euros. And the last visit was a visit to the podiatrist. I will spare you the details as to why I had to go to the podiatrist, but I made the appointment on Doctolib, and I went in April. I think I was able to get an appointment. I didn't write it down, but I think I was able to get an appointment within a week or 10 days, and I did have to pay out of pocket. So some of the treatments at the podiatrist are not covered by the CPIM, so you do have to pay out of pocket. So for the podiatrist, I did have to pay 40 euros out of pocket. Okay, so if we do the total, we can add up how much I paid for first the dental cleaning, cavity fillings, and wisdom tooth extraction, nothing. The bilan de santé, the checkup, the government health checkup, 0 euros. The eye exam, out of pocket, I paid 4 euros. For my nice new glasses, I paid 90 euros out of pocket, but that was a little indulgence. I didn't have to, I could have chosen something cheaper. The dermatologist, I paid 0. For the mammogram, I covered €2 of the cost. And for my GP visit, prescription and blood work that I had done, I paid €2. And for my podiatrist visit, I paid €40. So total out-of-pocket expenditures over the course of that time was €138. And I have a few other little data points to add into the mix. These are about family members, not about me, but my son, for example, needed to see the doctor as well on June 17th. I called and got an appointment for the next day, June 18th. The visit to the doctor for him, for the GP, same GP as me, was €30, and I paid by debit card up front. The CPAM reimbursed €21 on June 23rd, and our mutuelle reimbursed the remaining €9 the following day on June 24th. So the out-of-pocket cost for that was €0, and I think it's because he's under 16, and I think GP visits are reimbursed 100% for kids under 16. And my husband also had to go to the podiatrist recently, different podiatrist, different problem. He had to get some orthotics made, and the orthotics cost €172 for him, and he was only reimbursed €17.32 by the CPAM and €57.72 from our mutuelle. So we had to pay almost €100 out of pocket for that as well. And the last thing I wanted to mention was orthodontics. At one point last year, both of my kids had braces. My older son, I think he's done with his orthodontics treatments. I think he's finished. So that's a relief. But my younger son, he had his braces removed, and he's going to have to go back in a few years for another round of braces, poor kid. But I did just want to mention that because we didn't have to pay anything out of pocket. Well, we did have to pay for the treatments, but they were fully reimbursed by the CPAM and by our mutuelle. So in the end, we haven't had to pay anything for all of the orthodontics that our kids have had over the past few years, which is a big relief because I know that can be really expensive as well. So that's how much we've had to pay out of pocket for routine care for the past 6 months or so. But you might be wondering what happens in case of emergency, which is, of course, a legitimate question as well. France has a service called SOS Médecin, and you can call and a doctor will answer, and you can describe your problem and they will determine sort of how to manage your care. So oftentimes they'll either send you to an urgent care clinic or they will send a doctor for a house visit. It's not super common, but for example, if you have a child at home and it's the weekend or late at night or something, they can send a doctor to your house to make a house call. So if you went to one of the SOS Médecin urgent care clinics during the day, then it would cost the same amount as a regular doctor, and the CPAM will cover that cost, or they cover as much as they would cover for a normal doctor's visit. However, there are some surcharges that apply if you need care outside of normal office hours at night and on the weekend, for example. And depending on your mutuelle, you will be more or less well covered in terms of those dépassements, so the extra fees that you pay to get care outside of normal office hours. I can only think of 2 times that SOS Médecin has actually come to our house. Once was when my younger son was a baby and he had a fever and it was the weekend. And so they sent somebody over to check on him. And that was nice. And then the other time was during COVID, and both my husband and I were sick. And I think maybe it was like just a public health measure at the time, but they sent a team of 2 people over to our house in like full hazmat suits. And I had my very first COVID test administered to me from one of these SOS Médecin professionals lying on my couch here in my living room. So that was kind of crazy. And there have been a few times when we've just gotten in the car and driven to the emergency room. Like, for example, my husband fell and broke his wrist, so we just went straight to the ER for that. And then there was another time my younger son fell and got like a stick in his eye, basically. And that was really scary, so we just put him in the car and took him to the ER. So it kind of depends on the severity of the emergency, but usually SOS Médecin can at least sort of triage you and sort of point you in the right direction and tell you where you should go and help you over the phone at least. And for real medical emergencies, when you can't drive, you can call the number 15 from your phone. That's the SAMU, and normally they speak English well enough to understand any issues that you might be having. And if necessary, they will send an ambulance. And the ambulance normally is covered by the CPAM, and whatever is remaining is usually covered by your mutuelle. In terms of hospitalizations, the CPAM covers 80% of the cost of hospitalizations, and your mutuelle will cover most, if not all, of the remaining 20% of hospitalizations. However, there is a list of exceptions in which cases hospitalization is covered 100%. For example, women who are going into labor and who are delivering children are covered up to 4 months before and 12 days after delivery for the mom, and up to 30 days after the birth of the baby. The baby is also covered 100% in terms of the cost of the hospitalization. And we'll talk more about pre and postnatal care in just a minute as well. And in terms of dental emergencies, I wasn't really sure what to do. And this question just kind of came up for me recently because I myself was having kind of a really painful toothache about 10 days ago. And I knew that I had a cleaning scheduled, so I figured I could just wait and ask my dentist about it then if it still hurt. And luckily, the pain kind of went away. But when I saw her earlier this week, I asked her what I could have done if I didn't have a cleaning on the books and if the pain hadn't gone away. And she said that usually she's able to see people urgently, like within a week or so. So I could have called her and made an emergency appointment with her. There is a new dental care center in Dijon that just opened on the hospital campus. And I was just perusing their website to try to get some more information about them as well. And it says that they can see patients with dental emergencies without appointments from Monday to Friday. But to get there as early as possible in the day, it's probably like a first come, first serve basis. I'm not sure. I don't know anyone who's been there yet, but this new center does exist. So we do have that possibility in Dijon now as well. So to talk a little bit more about pregnancy and childbirth and women's health, my main experiences with the French healthcare system have been having 2 kids here. When I went through my first pregnancy, all of my prenatal care was covered, obviously, regular checkups, ultrasounds, everything just covered completely. Plus, I had a series of prenatal classes with a midwife. So teaching you how to breastfeed, change the baby, explain the birthing process, etc. And there was even a series of classes in a pool, like kind of exercise classes with other expecting moms, which was really nice. And my son was born here at the public hospital in Dijon. And when we went home after being in the hospital for 6 days, I kept waiting for a bill. I thought there would be a bill, and eventually a letter came from the hospital. And in my mind, I was like, "Oh, here it is. Here's the bill." And it turned out that I had just left a prescription behind, so it was a prescription for me. There was never a bill. We never got a bill. The entire process was basically covered. And after we got home from the hospital with our new baby, we had a series of visits from a midwife, and those were covered as well. She was checking up on me and checking up on the baby, making sure that he was eating well and gaining weight, and that I was doing well as well. And so all of that was covered. And then I was prescribed pelvic floor rehabilitation. In France, this is considered important enough to be covered as standard postnatal care. I was too squeamish to do it after my first son was born, but by the time my second son was born, I had decided that if the healthcare system deemed it important enough to prescribe it, then I was silly not to take advantage of it. So I did it after my second son was born. So my out-of-pocket costs for having 2 kids, for prenatal care, hospitalizations, labor, delivery, postnatal care, all of that was basically nothing. And I'm not going to go into talking about maternity leave, paternity leave, parental leave here in this video today, but I can talk about that more again in the future if you like. My friend, American friend Celeste, and I did go into that a little bit in a wide-ranging conversation that we had here on my channel a few months ago, which I will link to here. And if you're curious, you can check that out. And one last thing I wanted to mention about women's health is that I no longer go to see an OBGYN for my routine women's healthcare visits because midwives are able to provide most of the same services and care as an OBGYN. And it's usually much easier and faster to get an appointment with a midwife. So there's another tip for you. And in terms of just a few more practical tips, in terms of Doctolib, it really is great. It's really practical for making appointments. Unfortunately, not everyone uses it yet. So you will still have times when you need to call and make an appointment, which brings me on to my next point, which is talking a little bit about the language barrier. I think that most doctors have sort of passable English. My dentist says that she doesn't speak English, but I bet if push came to shove, she could get by a little bit. Doctors are patient and they are used to non-French speakers. And I think in emergencies, most of the time they will make it work. I think that they do have translators that they can contact as well in really extreme situations. Basic medical French is very learnable. A lot of it, we have a lot of words that are transparent that are basically the same in English and in French. A lot of our medical terms come from Latin or from Greek. So you'll probably recognize a lot of them. For example, pharmacie. anticoagulant, cholestérol, hypertension, artère, veine, antibiotiques, diabète, thyroïde, mammographie, hôpital, nutriments, syncope, déshydratation, arthrose, osteoporose, cataracte, cancer. And this is just a little list I put together just to give you an example of words that are basically the same in French and English. Of course, the pronunciation is a slightly different, but if you see them written down, you would definitely recognize them. Please don't let language fears stop you from getting the care that you need. Doctors will be able to muddle through with English, and I suspect that you'll be able to muddle through with some French as well. And otherwise, like I said, worst comes to worst, you can call for a translation service as well. So don't hesitate to get the care that you need. Don't worry about the language barrier. You'll be able to overcome it. And after the language note, here's a little cultural note. Just be prepared. French medical professionals are a bit more matter of fact when it comes to physical exams. There are not the same concessions to modesty. You are not going to be given a paper gown, for example, to wear. The doctor is just going to tell you to get undressed and to sit on the exam table. So it can be a bit jarring at first, but if you go into it knowing what to expect, then at least you'll know that it's normal here in France. The next thing I want to talk about was medical deserts, because I get a lot of questions and comments in my videos about this as well. So medical deserts are obviously areas where access to healthcare is limited. And from what I understand, it's true that some rural parts of France struggle with doctor shortages, much like rural areas in other countries do as well. But based on my experience here in Dijon, a mid-sized city of about 160,000 people, I don't get the impression that we are necessarily underserved at all. So I looked it up and I found this data from the French government, and it shows that the Côte d'Or département, where Dijon is located, is at or slightly above the national average for both the number of general practitioners and specialists. Granted, this data is quite old. And in my département, the entire population here lives within 15 minutes of a hospital, according to this other set of data. So this is obviously something that you want to take into consideration when you're considering different places to live in France. And like I said at the beginning, I wanted to touch on the international context as well and compare France to some other countries in terms of healthcare as well. The French system combines universal coverage with both public and private providers, and it's funded through Social Security contributions, which means everyone contributes based on their income and everyone receives care regardless of their ability to pay. And according to a 2024 report published by the Commonwealth Fund, France ranks solidly middle of the pack compared to other developed countries when looking at the performance of their entire healthcare system. So for access to care, care process, administrative efficiency, equity, and health outcomes, you can see France is solidly middle of the pack compared to Australia, Canada, Germany, Netherlands, etc. But the French system achieves this while spending less in terms of GDP and less per capita than the US, for example. Healthcare spending in the US is over $13,000 per year, according to this graph, versus about $7,000 per year in France. And headlines like this one from The Economist, which says France is a far healthier country than America, are relatively common as well. So is the French system perfect? No, but no system is perfect. As we have seen, some specialist wait times can be long, and some areas do have doctor shortages. And believe me, I know that this system is not free for me either. As an employee, a consumer, and a landlord paying taxes on rental income, I am paying significant taxes that go towards funding this system. Calculating how much I personally pay into the system would be very complex, despite the fact that people have suggested in other videos on my channel that I just look at my payslips. For me, it's actually more complex than that. I pay lots of taxes, lots and lots of taxes. But for me, that's okay. I am worried about the longevity of the system, and I am worried about the poor working conditions, for example, of healthcare providers. I know the system is not perfect, and I know it's in jeopardy, but for the moment, it does provide comprehensive, affordable, and accessible healthcare for most people here in France. And the fact remains that the system protects most people and also protects people from other catastrophes like bankruptcy due to exorbitant medical bills. In France, there's no fighting with insurance companies over what's covered, no network restrictions, no prior authorizations for basic care. You get your treatment, you show your carte vitale, and reimbursement happens automatically most of the time. I hope this video was a realistic and useful snapshot for you to give you an example of how the system works for me and for my family. If you are someone who is considering moving to France and you want to learn more about my life here in France, you can check out this playlist here. Don't forget to sign up for my email newsletter using the link in the video description below. And thank you so much for watching. Until the next time, à bientôt!